And so today's session, we're going to start with Miss Jessica Florence. And Jessica is a 26-year-old architectural student at Florida A&M University in Jacksonville. She has 5 siblings and no family history of breast cancer, but was recently diagnosed with stage 4 metastatic breast cancer. She continues to educate herself about this disease and share her journey as a millennial breast cancer advocate. And we know today we have in our world so many different types and subtypes of breast cancer. And a lot of our patients don't understand what types they're in. I'm just so glad that we have people who understand and try to get research and try to understand where they are on their journey and willing to share, just as Jessica is doing, with other people to bring them along. And so with that, we're going to hear from Jessica, is going to give us her story. And after that, we will talk about our next presenter. Okay, Jessica, you're on.
Well, good afternoon, ladies. It's nice to see your beautiful faces, and thanks for having me. Again, my name is Jessica Florence. I am an architecture student at Florida A&M University. I am 26 years old. I am from Jacksonville, Florida, and I was recently diagnosed with stage 4 metastatic breast cancer. There's about a 5-year survival rate for people who have the metastatic disease and the diagnosis. I was not always stage 4. Up until April 1st of this year, I was considered cured. And May of 2016 was when I had my first diagnosis. I was 22, and everything in my life seemed to be going just fine. I was working, I was going to school, had a new boyfriend, everything was just amazing. Up until I saw this lump that I was growing in my breast and that I felt in my breast. It was very painful. And it was evident that it was there because you could see it through my shirt. Late November of 2015 is when I saw my gynecologist just for a regular checkup. But I had told her about some of my concerns, and she did a breast exam, and then she suggested that they were just fibroids. And there had been no need for concern because I was too young to have breast cancer. But she didn't seem too confident about her diagnosing me with fibroids, only because she was my gyno. So she sent me to a neighboring women's clinic for a mammogram. I get to this clinic, I tell them that I'm here for a mammogram, and they tell me that I am too young for a mammogram. So I'm like, okay, well, how are we going to figure out, what's going on with my breast? So they ordered an ultrasound. They ordered for me to have an ultrasound. And then once I had the ultrasound, I was then given the satisfaction again that I was too young to have breast cancer. So again, they left me with fibroids. So I left the clinic. And I was just sure that it was fibroids. You usually trust your physicians, but I still wasn't sure about it. Fast forward to January of 2016. At this point, I'm so sorry. It's a lot. Fast forward to 2016. I'm so sorry, y'all.
You don't have to apologize. We understand. We've all been down this road. So we thank you so much. Just take your time, sweetie. And thank you for sharing and being open about your story.
2016, I was diagnosed with stage 3A breast cancer. And I was 22 at the time. I'm sorry, I keep repeating myself. I was diagnosed with stage 3A breast cancer, and I was HER2 positive. At that point, in that stage, when you're stage 3A, the tumor is more than 3 to 4 centimeters in diameter. And at that point, it has spread to your lymph nodes. And again, I have no family history of breast cancer, so I have no idea where this is coming from. And my diagnosis is more hormone driven, and it's more aggressive with that HER2 gene. And that HER2 gene is a human epidermal growth factor 2. And it causes the mutation in those cells, and it grows at a rapid rate, and actually at an uncontrolled rate. So for 6 months, I had endured chemotherapy. I had a unilateral mastectomy in my right breast. I had breast reconstruction. I had radiation, and I had immunotherapy of Herceptin for another 6 months. So by 2017, I ended up going back to school. I felt okay. I was still getting my checkups every 3 to 6 months. Everything was going fine. So August of 2017, I went back to school. But at this point, I started having headaches. I had headaches every day for a year, but then the headaches went away. So by last year, 2019, I did a 9-month internship as an architectural designer. And me doing architecture, the headaches came back. I had a headache every day up until April 1st, again, of 2020, this year. I had an emergency room visit prior to me having these headaches. And I told the emergency room, hey, I've been having a headache every day for the past year. I have been having nausea, and I've always been told to tell my doctor that I have a history of breast cancer. And so at that point, they were like, okay, well, what we'll do is they treated me for a migraine headache, and that's what they diagnosed me with, just a migraine headache. They gave me some medication. I fell asleep for a few hours, and they sent me home. Now, I had another episode. This is me after the 9 months of the internship. Now I'm in March, and I have another headache, and I'm having nights where I can't sleep. Again, every day, I don't even know what it feels like to not have a headache. Nausea. I went to the urgent care. I'm so sorry. I went to urgent care March. I'm having nausea, I'm having headaches, and I'm telling these people I have a history of breast cancer. And even if you couldn't do anything for me, you couldn't, at urgent care, they tell you, you can't go on an MRI machine, you can't get a CT, you can't get a PET scan. All they can do for you is prescribe you medication, and that's it. So again, I was sent on my way. The pandemic came, and funny story is I have been blogging on my Instagram about how COVID saved my life. If it wasn't for this pandemic and me having to come home, I would have never seen the doctors that I've seen for those headaches that I was having. Fast forward to April 1st, I was rushed to the emergency room because the night before I was having another headache. I threw up blood, bowel, anything you can name, I was throwing it up. I still had a headache. I went to the emergency room, and I told them my concerns, and I told them I was having a headache, nausea, history of breast cancer, and the doctor looked at me and said, I need to get you on an MRI machine. And there were 2 people ahead of me, and he took those 2 people off of the MRI, in front of me, that were supposed to be on the MRI machine, and put me on the MRI machine. 10 minutes of me going through the MRI machine and me coming out, I had to be rushed to the emergency room for emergency surgery. And that's because I had a tumor the size of a pancake on the back of my head, alongside another tumor that was the size of a gumball that was in my brain. And they diagnosed me with stage 4 metastatic disease. It's still breast cancer, but that HER2 gene has traveled to my brain at this point. So it went from not my breast to my lymph nodes, but to my brain at this point. So as of now, that is what I am dealing with, stage 4 metastatic disease. And Black women are dying at a crazy rate from not only breast cancer, but the metastatic disease as well. And one thing that I dealt with going through another phase of breast cancer, this treatment is a lot different. Thank God that with the HER2 gene, you are now able to have a targeted treatment where you have the Herceptin and Perjeta to target that HER2 gene and shrink that tumor down. So that's what I'm currently getting treated for. But it has not only spread to my brain, it has spread to my bones as well. So I have cancer sitting on my bones in my pelvic, not my pelvic area, in the back of my spine right now as well. So I have recently had 10 rounds of radiation, and I've had 2, and it's not chemotherapy, it's immunotherapy, the Herceptin and the Perjeta. And I'll be getting that for the rest of my life because apparently the stage 4 is incurable. And stage 4 is just something you live with. I won't say that I won't live a good life and that it can't go away, because God can do amazing things. But yes, that is where I am right now. I had to let these people know, as an African American woman, the standard of care is going to be different than someone of another race. What I experienced was during radiation, I had a head full of hair, I had an afro, and when you get radiation to your brain, I'm going to show you the mask. I'm so sorry, I'll be right back, but I'm going to show you the mask that they put on my head to get radiation.
While she's gone, I'm going to sing. Oh, well, there she is. She's back
Here we
now.
go. This is the mask that they put on my face for radiation. And imagine me having a head full of hair. They have to make this mold. In order to treat you on a table. And this is how it goes on my face. And imagine me having a head full of hair, getting that treatment. And so I kept telling them that, hey, I think I have product in my hair, and it's affecting me being on that table. My head is on fire. My headaches are getting worse, and I'm telling them all these symptoms and side effects that I'm having. They told me I would have to wear my hair a certain way every time I put this mold on to make sure I was stationary on that table. And I'm telling them my hair is falling out at this point, and that I have product in my hair, and it kind of just went in one ear and out the other. And so it got to a point where I had to force them to make me a new mold, because the fact that my hair was falling out and I was going bald, and my hair is not fitting that mold anymore. So it got to a breaking point for me where I'm like, I'm tired of crying to you guys and you're not listening to me. I need a new mold. I have to cut my hair off. I can't keep putting product in my hair to fit this mold for me to be on this table. So that is just to say that I'm so sorry. I just felt like I have been ignored for a long time. Not only the first time, but this second time. I feel like I'm talking in circles now. I'm so sorry, but
I would just like to say, I think that you're talking so eloquently, and I really struggled to ever be coherent, and I just was thinking how well you were holding it together and telling your story. So on my end, it's very coherent and it's very easy to follow.
Thank you. It's just, and after me having brain surgery, it's hard for me to remember my story sometimes. And I think that's what hurts me the most, is because I went through a significant journey my first time, and I was proud to show the world, you know, what I had been through, what I went through. And I used my Instagram as my platform. Like, I showed everything. I showed my mastectomy, even me with having one breast, my face, like what my skin, like African American women go through with our skin and our hair, like it's different. So I use my platform to show the good, the bad, the ugly. And like now with me going through this again, it's just like, how could you be so negligent? Even if you couldn't give me a diagnosis because you weren't the right doctor for it, you could have gave me some suggestions on where to go and, you know, who to see. And it's hard for me to be sharing a whole nother story that some of it I can't remember, you know?
Mm-hmm. Yeah.
It's really, 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 really tough. Really,
Thank
really.
you.
But
Thank
thank
you,
you.
Jessica. Thank you so much. And our hearts go out to you. I'm always amazed at the stamina and the resilience of cancer patients when they go through all of these difficult, trying times and they still bloom. My hat's off to you. And I think most of us probably are breast cancer survivors that's on the platform. But to hear your story, it just kind of melts my heart. And I think that the insensitivity of the society that we live in, and it's not, you know, just we look at what's happening in our community, but even with the cancer patients and not getting the type of service that we need when we need it is one of the things that we have to overcome with. So when I see people out in the street struggling and crying and saying, listen to me. And that's what I thought about as you were talking, is that we've got to speak up. We've got to be that voice. And thank you so much for sharing with us and just sharing your vulnerability with us and letting us know where the pain is. And I want you to understand that we all have our arms around you, and we can't do it physically, but we are hearing you. We touch you. We feel you. We feel your pain, and thank you so much for that. And so we're going to move on for the sake of time and introduce our next speaker for this
Sorry.
hour. And that's, you okay? You okay? It's okay. And so we're going to introduce Nicco. Nicco is a holistic health and wellness educator. She's a coach and advocate. She has a passion for health, wellness, and health equality, with the belief that each person should be able to live their best lives. Nicco completed her master's in arts in holistic health education from John F. Kennedy University in 2010. And continuing her journey and passion for food, Nicco became a certified natural chef in 2011. And so she brings to us over 20 years of experience with social service and health education, working with the diverse populations, underserved communities, and systems that serve others. She's actually going to share some slides with us because she's going to talk about health advocacy, disparities, and racism, and how to avoid some of these pitfalls. And we need her voice to ring loud all across this world because we really need that great advice. And so I present to you Ms. Nicco Turner.
Thank you so much. Good morning, good afternoon, depending on where you are. I feel so blessed and humbled to be a part of this platform right now. Ms. Loretta, Ms. Tia, let me thank you in advance for allowing me to participate and be part of this. Jessica, thank you. Thank you for sharing your story. Thank you for being vulnerable. Thank you for being authentic. Thank you for using your voice. Thank you for never stopping to use your voice. Thank you for not being silenced. And just thank you for sharing. Don't ever apologize for anything that you've done. And don't apologize for the things that you can't change at this point. You did what was best for you at that time, and you will continue to do so. Don't let anyone tell you what you could have, should have done. You did what you were supposed to do in that moment. And for that, I applaud you and thank you for sharing. So like Ms. Loretta said, I've been in this field of working with mostly populations that have been silenced across the board, whether it's been in social service or in healthcare. Our voices are not heard at all. We're usually in places where people are making decisions for us, whether that is in social services or healthcare. People are making decisions and we're supposed to just go along with those decisions. And initially I was going to just speak, but I thought that I would do a PowerPoint as well, because I think hearing words and seeing words can be doubly powerful. And in light of what we're going through right now with the protests, it's so similar because everyone is out there trying to be heard. People are trying to be seen. They want to be understood. And some of those same barriers and obstacles definitely intersect with healthcare. When we talk about why we're protesting, when we talk about why we're having this webinar right now, racism is at the center of that. And with Jessica, you spoke about, how that looks for African-American women. Racism plays a part in that. Equality, that definitely is part of what we're trying to accomplish. Injustice. And a lot of times people don't see how that extends to healthcare, but it is in the forefront. That being heard, that being seen, that stepping out on being uncomfortable, because it's uncomfortable to tell someone that has that white jacket or that white coat that, you know what, I don't think that's what it is. No, that's not really it. No, I'm having these symptoms. I'm feeling this sort of way. I think that we should dig a little deeper. I think there's more to this. I don't think that you're getting it. That's a hard conversation to have with someone when we've always been told, this is the professional. This person knows what they're talking about. So a lot of times we take it with a grain of salt. We take that information and we go home and we sit with it, even if we know that it didn't really sound right. Like, I don't think that's what it is. I don't think that's it. I don't think that person got it. And we go against our gut and our intuition and just not really thinking about how that injustice, that racism, and that bias, conscious or unconscious, plays into the health that we get, the referrals that we get to specialists, and the time and understanding that we get for being who we are and what we bring to the table. And so I think at some point we've all been patients. We've all maybe at some point felt that an appointment just did not go the way we wanted it to. We may have left there feeling like we were not heard. We may have left feeling like this was a waste of time. This was a waste of energy, feeling defeated, angry, pissed for lack of a better term, and really not wanting to follow up. The care that we've gotten does not make us want to return to that same person to have that same type of treatment. So being able to advocate for ourselves is very important, but stepping out of that comfort zone can be challenging. It can be hard. So I just want to bring that bit of knowledge and information and experience and expertise and being in that position of not being heard as a patient, not being heard as a Black woman, and just what does self-advocacy look like? Because I know on the other side, from the health professional aspect, it looks a little different. So just being able to have that conversation about self-advocacy, what it is, what is not, how to be an effective advocate, and how to let your voice be heard. So I'm going to share my screen. Okay, maybe I'm going to share my screen. Okay, let's see. Okay, can everyone see my screen?
No, it's not showing.
Okay.
Let's see.
And while she's pulling her screen together, I just sent a message to chat for everyone. If you have any questions for any of the speakers, please put those comments and questions in chat. And at the end of presentation, we'll be able to address as many as we can. If we can't get to all of them, we will still send out an email to you guys and try to answer those at a later time. But feel free to put questions in chat. Thank you.
Okay, so if it does not allow me to share, then we'll just go through.
I was going to say, if you want to email them to me really quick, we can get them up for you while you're talking through them.
Okay. Well, the first thing is that we're talking about, like, what is self-advocacy? And so self-advocacy is the action of representing oneself or one's views or interests. But self-advocacy goes so much far above and beyond the act of simply representing oneself or one's views or one's interests. Self-advocacy is self-love. It's self-respect. It's knowing yourself. It's patient-centered. It's knowing what's important. It's trusting your intuition. It's knowing what you need. It's letting others know what you need. It's letting your voice be heard. And it's knowing yourself better than others know you. There's definitely this misconception that when you go to the doctor, that doctor is all-knowing and that they know more about you than you know about yourself. So self-advocacy is definitely knowing that you know yourself better than others. You are in your body every day. You know how things work. You know how you feel. You know what's working, what's not working. And that is valuable. No one else can be in your shoes and no one else can tell you how you're feeling. If something isn't right, they don't have that right, nor do they have that ability. Self-advocacy is not taking no for an answer. It's not taking no for an answer when you know that there is a different answer, when you know that there are other resources, when you know that there are second opinions and third opinions and fourth opinions, until you get what you need to get for yourself to make you feel comfortable with what you're getting. Self-advocacy is knowing that it's not just in your head. It's not psychological. It's not something you're making up. It's not something that will pass. It is your feelings. It's knowing what is going on with you and with your body. It's not something that you're just making up because you want to come to the hospital or you want to come to the doctor, or because in some instances there's this thought that because you may want medication. It's you knowing you, it's you knowing your body and knowing what you need. It's knowing your rights. Self-advocacy is knowing your rights as far as your standards of care, the treatment that you should receive, and what that should look like. Self-advocacy is about knowing that there is a reason. It's a reason why you're having these symptoms. It's a reason why you're not feeling good. It's a reason why you're not sleeping at night. And at the end, self-advocacy is empowerment. It is that ability to share your voice with others. And it's about being able to let people know that you are worthy, you are valuable, and that you deserve the care that anyone else would get. So a lot of times, self-advocacy can be seen by professionals at times as being a negative. But what self-advocacy is not, it's not disrespectful. It is not meant to be disrespectful to the healthcare providers or the professionals that you see. It's actually the opposite. It is respectful. It is that respect that you have for yourself. Self-advocacy is not disregard. It is not disregarding the medical professionals in their opinion and what they're bringing to the table. It is just you sharing your voice. It's not demeaning. It's not meant to make this person or this professional feel as if their education and their knowledge is not valued. Again, it's bringing that additional information and knowledge to help them do their job better. Your voice helps them to work with you to find out what's going on with you. Without you, they can't do that. They can't just eyeball you and tell you what's wrong. They need your voice. And it's not undermining. If you decide to seek 15 other second opinions, that's not undermining. That's you being an advocate and looking out for yourself. And it's not attacking. You're not attacking. You're standing up for yourself and your values and what you need and what you deserve. And with being an advocate, it creates partnerships. It builds relationships with your provider if they allow it to happen. It increases your communication. It allows you to be able to have those hard to have conversations with one another, with the understanding that these conversations are going to lead to additional resources. They're going to lead to understanding. They're going to lead to connections with other specialists who may be better suited to work with you. It's going to increase your opportunities to seek and have those other services that are out there. Self-advocacy promotes healthier lifestyle, and at the end of the day, it saves lives. And that's what it's really about, is having your voice heard and making sure that your life is at the forefront and your health is at the forefront of everything that you do. So it sounds a lot easier said than done to just decide to be an effective advocate for yourself. As I stated before, sometimes it's hard to have those conversations with that person in that white coat and to let them know that something is not working for you, or something is not accurate, or things just aren't right. So when you start to build those advocacy muscles, there's some things that you should start to put in place to make you a more effective advocate. So, because it may take practice for you. Some of us, it may not. You may be able to walk in the room and just let your doctor or your health professional know this is what it is and this is what it's not. But for others, it may take a little bit of practice. So practice what you will say. Think about what you want to say to that provider when you have that visit. Be prepared. Write down questions if you need to. Bring information that you have. Share your story. Be honest about the care that you're getting and receiving and what's not working for you. Be assertive. Make sure your voice is heard and is heard clearly. And I know that with Black women, that is a fine line when it comes to being assertive and not being that angry Black woman. We're using the word assertive, but if you need to be that angry Black woman to get what you need for your health care, that's who you need to be. If that's how it is taken by that person, at the end of the day, as long as you're able to get your services, get what you need and be heard, that part is null and void. Ask questions to find out everything you need to know, and keep asking questions. If you don't get your questions answered, ask again. And be prepared to listen for some of the things that you may not have known, and listen for opportunities to ask additional questions or opportunities to decide if this is the person who you want to place your care in their hands. So listen for some of those messages that are contraindicative to what you need and what you would like. If you're hearing that this person really is not listening to you, listen for that talk. So start to think about what your next steps will be. And even if that means changing to another provider. Keep documentation and follow up. If your provider says he or she is going to check into something, they're going to look into the specialist, they're going to get a referral for you, follow up with them. Make sure that they're doing it. Hold them accountable for what they're supposed to do for you. Seek other professionals, seek other opinions. Again, that's your right to seek other professionals to make sure that you're getting the full story, you're getting the information that you need. And expect the unexpected. Go into your conversations knowing that you may have a professional that is on board and who's willing to step up and be that collaborative partner with you being that advocate. But also expect that this doctor may not. They may be offended that you're speaking up for yourself. They may be offended because within themselves, there's some inadequacy. So expect the unexpected when you just start to have these conversations. And don't take it personal, but take it personal because it's your health. Don't self-blame, self-shame, but take it as personal as you need to take it because this is your health. And if you don't have that advocacy muscle that's strong enough right now, have an ally. Have somebody there with you that is going to support you, have those conversations, and be there. And why we must speak up, all healthcare is not created equal. There is bias in healthcare, conscious or unconscious, that show up as far as the services that we receive and how we receive those services. There's difference in healthcare. There's difference in providers. The standard of care that we receive as Black people is not always quality of care. There's still myths out there around Black health and what that looks like as far as our care and our treatment, and health disparities that play a big role in the treatment that we receive and why we receive it. And those play a part into misdiagnosis and late diagnosis. And so at the end of the day, advocacy and speaking and having your voice saves lives. It saves your life. It can save the lives of others. So being able to have those conversations is the most important conversation you can have. And being able to be that advocate for someone if they can't be that person for themselves is what we need. We need to be able to hold each other up, hold each other accountable, and be there to support one another to make sure that our voices are heard and we start to reduce these health disparities, address these biases in healthcare, and hold professionals accountable for how they treat us and how we want to be treated. So for the challenge out there is, how do you want to be heard? Thank you, everyone.
Thank you. That was some great information that Ms. Nicco has shared with us. And before we get off into our Q&A session, so go ahead and start typing your questions in and I'll come back and read them off. But I do want to make the announcement that each of our sessions, we do gifts. And that's one of the ways that we say thank you for joining us. So names will go into a drawing and you will receive a gift. Well, today's gift is going to be from Nicco Turner, and she's going to give, her gift is a free coaching session. Because of the work she does, she's going to share that with one of our participants that's online today. And so we want to thank you guys for tuning in. I'm looking for questions, and right now I don't see a specific question, but I do have some great information to share. And that information is that Deborah had a information that she wanted to share with us, because we're in this season of uncertainties, not just with the COVID, but also with the racial tension in our country. She is sitting on a panel with the National Breast Cancer Coalition, and that's where she's going to a meeting today. But her comments was, if any of you ladies would be willing to share with me further about racial disparities in breast cancer care and allow me to share my experience, your experience, please contact her on any anti-racial experiences that you've had. And her number is listed in the chat. It is, she wants you to reach out to her at 949-933-0258. Or you can contact her at SOARSUR survivorship@gmail.com. And this article will be posted in SOAR FB page, as well as featured in the Stand Up for a Cure newsletter. So, you know, feel free to reach out to Deborah. That's Deborah Stratford, if you have any needs for sharing your story. And the only way people can find out what's going on in our community of survivors, if we tell the story. There's an old African proverb that says, the lion always get the glory. No, the hunter always get the glory because the lion never tells the story. So we have to share our stories. The first question I have so far, it looks like, it says, how can we identify these biases to avoid the pitfalls so that we can have better outcomes? And that's a very good question. And I think she's addressing it to you, Nicco.
Think about biases is that sometimes, depending on who you're seeing, sometimes those biases are obvious. Sometimes they come across in what that provider is saying, and other times they're a little bit more behind the scene. So again, when I talk about listening for those words or listening for those actions, you may not necessarily hear it with the provider that you're seeing. They may not outright say something that's disrespectful or something that's tied to a bias. They may not say outright, well, you know, Black people are always trying to get medicines. You know, it's in your head. They may not outright say that, but that's when you have to look at someone's actions. Mm-hmm. If you're there and you're expressing yourself and they are not stepping up to meet that challenge, it's something that's underneath that. It's something that may be their own unconscious bias of why you're saying, I'm having these symptoms, and you'll continue to have that conversation with that person. There may be something to that. So not only listening, but following up with the actions so that you don't stay in this cycle of going back and forth with this provider. After asking a couple times, like, I think I should see someone else, or I think I need a referral, then it's time to move on. My thing is, don't spend a lot of energy where you don't have to. If this doctor is not showing up for you, then let them know. And sometimes that prompts it. You're like, you know what? Maybe I should see someone else. Sometimes that prompts that for that provider. And at that point, that may prompt something for you. You may feel as if I have to threaten you, then maybe you're not the person for me. But biases can be sneaky. They can be sometimes hard to identify. But besides the bias, it's the action. So if you don't necessarily hear the words, look at those actions. And no, it's okay. I used to tell patients all the time, you can go through every provider in this clinic until you find someone that works for you. If you need to file a grievance every other day, you do what you have to do. But this is your health. Don't worry about them. They're good. But listen to what they're saying and look at what they're doing. So
I wanted to piggyback off of that. That's why I get so emotional when I speak, is because it's like, I was 22 initially when I found out that I had breast cancer. And it took 3 different people, not even including my oncologist and the other people who were testing me. But it's like, I could have had a lumpectomy opposed to me having a full mastectomy, chemotherapy, radiation. I'm telling all these people about this lump in my breast, and I keep getting, you're too young. Next person, you're too young to have breast cancer. Oh, it's fibroids. All these misdiagnoses, all these biases, like, you're too young. And a lot of people are like, oh, you African American, you can fight it. Like, what does that even mean? You know, it just doesn't make sense to me at all. But Nicco, you speaking. that's all I'm gonna say. I had to piggyback on that because, like I said, I can't take it anymore. Like I tell every doctor, I'm tired. I'm 26. I should not have to go through this as a 26-year-old going through menopause. Like, I can't even have children right now. That's not an option for me. It's not. So
One thing I want to share, this is Tia, that I found interesting. It actually popped up on my social media page today. Last year when I was at ASCO today, I actually attended one of the well, at the conference, I attended one of the sessions, and they talked about biases. So it's interesting that we're having this same discussion today. They talked about biases in the medical profession. And one of the things that they said, they did a study, and they asked the question, they said, they asked physicians their thoughts about how much information do white families want to know when it comes to their health or their children's health. And so when they asked the physicians, they said, okay, you know, for the white families, what do you think this is? And the white families said, they asked the families first, and 86% of the white families said, we want to know as much as possible when it comes to our health for our children. When they asked the black families, 92% of the black families said, we want to know as much as possible. When they asked the physicians, what did they think? 81% of the physicians felt as though white families wanted to know as much as possible. They asked them about black families. 25% of the physicians felt as though black families wanted to know as much as possible. And so when we think about these biases and we look at this, these are the reasons why we're not getting the quality of care that we need. And so it's so important for us to use our voice and speak up, whether it be, you know, finding out ways within the hospital, how can you be a part of boards or committees that they, you know, have at the hospital with patients so that you can be a part of the conversation, because we know a lot of, you know, we know about the disparities. We hear about it. COVID is definitely something that's revealing to all of us about the state of affairs in healthcare when it comes to the African American families. And so how do we break these barriers down? And it's not just, you know, black people taking a stand, but we also need allies from our white counterparts to even speak up when they see things that are not right. Or even just having the conversations. I remember going through treatment myself and having conversations with people within the infusion center, and learned how things were different for me than it was for someone else. And it led me to ask questions, because it was like, why is this different between you and I? And you were diagnosed with the same exact thing as I was diagnosed. Why is your treatment plan a little bit different than mine? And it wasn't so much to question the doctor, but it was more so to get understanding, so then I can be a part of making the informed decisions for my own health. So Nicco, as well as Jessica, you guys are so on point, you know, and it's so important for us to be the voice, to speak up, because there's so many women who don't have a voice. And it's not so much that they don't have a voice, it's what we've been taught. You know, the white coat is the professional. The white coat is the expert. So let them, you know, tell us what they're gonna tell us, and we believe it. And then we don't push, even though when God has given us intuition and we know something is not right. And that little thing just sits inside of us and it eats at us, but we don't speak up and we don't say something. And because we don't speak up and we don't say anything, our quality of care is lacking. So it's so important, and I want to thank everybody who joined us today. You know, continue to be the voice, continue to speak out, whether you're a caregiver, whether you're a patient, whether you're a provider. And I think it's time too for providers and patients to sit at the table together and listen to each other. Instead of, you know, having these moments of speaking over top of each other, we really need to listen to each other, because at the end of the day, all of us are human beings. All of us. take the white coat off, whatever. We're all patient at some point in our lives.
Yeah.
At some point in our lives, we're all patient. And so if we sit at the table and have a dialogue and understand, you know, the challenges, because there are challenges on the patient side and there are challenges on the provider side, especially now with all the stress that they're under, you know, trying to keep up with the newest technologies and the new medications that are coming out, you know, and a lot of things they just don't know. But it's so important for us to start listening to each other. And I'll share something that happened to me recently, and it's something I'm going to have to address. I was in a hospital for 2 weeks, and prior to me going into the hospital, typically I get blood work done before I see, the week before I see my oncologist, because it used to be I get blood work done and I see my oncologist the same day, but there was nothing to talk about because there were no results. And so I started to make that change, and I went to my doctor on Thursday, had my blood work done. Friday, I got sick. Monday, something told me, go in the patient portal and look at your test results. All of my blood counts were all over the place. My platelets were low, my red blood cell count was low. I mean, it was all over the place. And I had never seen that. And so I ended up going into the hospital, but no one from my oncologist's office called me to say, here, we see something in your blood count, go to the doctor, come here, get checked. No one said anything to me. And I was so upset. I ended up calling them Wednesday and canceled my Thursday appointment because I told them, hey, I'm in the hospital now. And I even talked to the nurse at the oncology office and told her, I said, you know, even when I looked at my test results, something was off and no one ever called me. She said, well, I'll tell your oncologist. Here it is, what, 3, almost 4 weeks later, I still haven't heard from anyone. And so I'm going to have to address this. And, you know, and I question why. Not so much the what, but the why. Why did you not call me? When you've called me any other time, why did you not call me? Because that could have cost me my life.
Right. And
I went to urgent care and they rushed me to the ER, you know. That could have cost me my life. And the simple fact that they didn't call, I'm going to have to address it. And so these are the types of things that we have to look at when we go through, that we cannot be silent. We cannot be silent, because not only can it save my life, it could save another patient's life.
Very good. Very good. And we did have another question from one of our viewers. Thank you so much, Tia, for sharing that information. But it's along the same line. This particular viewer says that I was displeased with my care, and she is a breast cancer survivor. I thought about changing providers, but I didn't. I'm still a little unsure. Should I change providers since I have to be followed 5 more years? And so I guess, Nicco, if you could address that from one of our viewers today.
Well, it's hard to tell someone what they should do. So as a coach, I'm going to pose this question back to you. What do you want your healthcare to look like for the next 5 years? Thank you. Is this someone that you want to, you know, have your health care in their hands? And when you think about, if you do decide to change, what characteristics, what values, what morals do you want that next provider to have?
Right. And along those same lines, and I'm thinking back to what Tia was just saying, even with our healthcare providers, sometimes we have to educate them. I know it's not with my breast cancer, but with another illness that I had. I was borderline diabetes, and then it blew up to diabetes. You know, when the numbers get up to like 6 point whatever, everybody panicked. And so they assumed I wanted metformin. And I told them, no, let me try this with exercise and diet first. It took a few months to get my numbers down, but at least it worked. But I don't want to be the person that says whatever the doctor says, I'm going to go along with it. And so sometimes you have to look back, take a step back, look back and see, what do you want for yourself? And so if that means educating your healthcare providers, or do it mean changing? and I agree totally with you, Nicco. You have to say, what do you want for yourself? So that makes the difference there. And it was another thing you mentioned during your talk about having an ally. When you're being diagnosed, and I kind of heard this with Jessica in her talk, you are in a very vulnerable state. And a lot of stuff you don't hear. When they told me personally, you got breast cancer, the rest of the conversation was out the door. Had I had somebody right there with me to talk, ask the right kind of questions and talk me through it afterwards, then I would have probably got a better understanding of what went on during that particular meeting. Because when you hear you got cancer, everything else goes out. You don't hear anything else. And so it's so good to have that person, that ally, somebody there with you to help you through that. And 9 times out of 10, when you go to the doctor and they tell you got cancer, you're not prepared for that. Nobody's prepared for that. And so you don't know to take somebody with you unless it's a habit that you've already developed along the way with your health care. And so those are the kind of things that advocacy actually looked at. How are you actually dealing with where you are even today, before you get diagnosed, and also, of course, after you get diagnosed? Next question. Ms. Terry. Terry says, I can speak about that, going to providers where they are now at the mercy of patients. Right now, new information that was unmasked due to COVID-19. And so much has come out of this COVID-19, and we see it. It's on the TV, it's in our faces. Go ahead, Terry.
Oh, okay. Hi, I don't know if you can hear me.
Yes, we can.
Okay, I just wanted to share something. Hi, I'm Terry Larkins. I actually work in cancer prevention and by training cancer biologist, and just recently got off of a call at work in reference to cancer and COVID at this time. And I just wanted to kind of share with you all where the healthcare providers are at this time. One, we know screening has gone down. Also, people getting their follow-ups and so many different things, the tests and so many things have actually gone down due to somewhat patient afraid. Also, even providers at this time being afraid to open up doors. Things are starting to happen right now. But I will say, just to let you know, most oncologists are in the age range of 40 to 50, in the 40s and 50s at this time. So guess what? This workforce demographic for oncologists, it's at a deficit. They're going, unfortunately, soon what we're seeing, and this was just stated to me and actually shared, that this field is definitely more oncologists are needed. And in addition, to speak to what we are all saying on this call, there has to be where healthcare providers and patients are working together, listening to each other, because I'm going to tell you, what's going on in this country, social economic positions and things are actually, there's an intersection right now. People are seeing where healthcare providers who are in private practices, patients aren't coming to see them. Their livelihood are being jeopardized, their mental health, as I think Tia stated. So what we are going to have to do is we're going to start to see a shift, and I'm praying for the shift, that people are going to have their listening ears on, working together to one, solve these health disparities because of the workforce declining in the oncology field at this time due to, unfortunately, people either not being interested in going into that field, or even, we're not saying interested, but the people who are now in this field, they are starting to be phased out due to their, growing older, and we need some new fresh faces right now. So just wanted to kind of add that in there, and just offer that new information that I just received. Thank you so much for this.
Thank you, Terry. We are actually past our time, but I do want to acknowledge our sponsor, Amgen, who helped to sponsor these events, these series. And please, guys, if you have any additional questions, just text them to us. You can email them to Tia or to myself, or you can just reach out to each of us. And please don't forget Deborah's request to give her a call if you're interested in the racial disparities in healthcare, and then she can do and put you in the newsletter for their upcoming events. And so with that, I'd just like to thank everybody for being a part of this. Thank you for taking the time, and remember that we have about 3 more for this month coming up, and we want to make sure that you get involved in those also. And please share it with your family and your friends and other people in your network. Thank you so much. Tia, did you have any additional comments before we close?
Before we go, I want to share with everyone that I have joined Tiger Lily in the Inclusion Pledge. And let me tell you what the Inclusion Pledge is about. And I'm asking everybody to sign the Inclusion Pledge. I will be posting it on the My Style Matters page. With all that's going on in the world today, and especially in the breast cancer space, we know that Black women have the highest mortality rate than any other ethnicity or racial group that's out there. And we want to make that change. You know, this disparity is unacceptable. And we want to make that change. And how we're looking to make that change is to make sure that the voice of the Black patient is heard. Black breast cancer is Black cancer, and Black breast cancer is totally different than any other cancer. And so we really want to bring forth change. And so we've come up with a pledge where you can identify whatever that pledge looks like for you. But for us, it's making sure that whatever we do as advocates, that the voice of the Black patient is heard. So whether we're invited to be on a research panel, whether we're asked to talk, you know, in a, you know, at ASCO or AACR or what have you, it's making sure that we give a seat at the table for an African-American woman. It's also encouraging other organizations to create something, you know, whatever it is, whether it's talks, whether it's, you know, advocacy work or what have you in the Black community, because we really want to lift these women up. We want their voices to be heard. We're challenging corporations. We're challenging nonprofit organizations. We're looking at the pharmaceutical companies and our sponsors to say, hey, when you do clinical trials, we're holding you accountable to make sure that you are actually recruiting patients. I don't know if you all know, but Gilead came out with a drug product not long ago. There were 0 African Americans in their clinical trial. And this was centered around COVID. Which community is impacted by COVID? African Americans. And to have no patients, 0 patients that were a part of your clinical trial, that is totally unacceptable. And so as part of this initiative with Tiger Lily, we are looking to the community to say, look, no more. We all want to be a part of the solution. So I'm asking you all, and again, I'll be posting it on the My Style Matters page on Facebook and on Instagram, to be a part of the Inclusion Pledge. So when you're asked to be a part of talks, or you're asked to be a part of initiatives, you're asked to be a part of documentaries, videos, whatever it is, make sure that a Black woman has a seat at the table, because their voice is just as important. And we shouldn't even have to be having this conversation. We shouldn't even have to have the conversation that our lives matter too. But we want, you know, it's a reality, and we're having to do this. So we're asking everyone to be a part of the Inclusion Pledge. We're not saying that no one else is important, but we're saying, hey, we matter too. Our lives matter too. 40% and 45% in Atlanta is unacceptable to us, that Black women are dying from this disease. So please join us. Again, I'll be posting it on our page. Please join us in this fight. We can't do it alone. Thank you, everyone.
Thank you, guys. Have a good day.
Thank you. Have a good day, everyone.
Great job, Nicco.
Thank you.
Thank you, Nicco. Thank you, Jessica.
Yeah,
I think
thanks.
he disconnected, yeah. I'm going to, someone mentioned a book entitled What Patients Say and What Doctors Hear. I think that's going to be something good that we can share. So I'm going to see if I can find that in some kind of way, and maybe I can actually order that and use it as a giveaway as well. Because I think that, you know, that is Let me just write this down.
That
What
was
page?
Ty. Was it Ty Hay?
Uh-huh.
Ty Hayes?
Yeah.
Yeah. Okay.
I'm just typing it out so I can make sure that I go look it up and order it on Amazon, and I'll get that out. It's something I definitely will want to read too, because it's so true.
Yes.
I remember my when I was in a lot of pain going through treatment, they didn't get me to pain management. It took them 4 weeks. And my mother
Wow.
said to my doctor, my mother said these exact words. She said, when she says she's in pain, what is it that you hear? And so to see this book is what patients say and what doctors hear resonates with me, because those were the words that my mother said to the doctor. When she says she's in pain, what is it that you hear? Because apparently you're not hearing what she's telling you.
Right.
But, so, OFRI. Awesome. All right, ladies, thank you. And we'll send everything in a follow-up email to everybody who registered. I'll send these resources to everyone. We'll also send the video clip to everyone for them to be able to look at. We'll post it on our YouTube page.
Okay.
And trying to think, is there anything else that I need? Oh, and then Nicco will draw the winner and let you know who the winner is so you can reach out to them.
Okay.
Yep.
Sounds good. Have a
All
great day, guys.
All righty. Take care.
Bye-bye.
Bye-bye.